What is aortic stenosis? Aortic stenosis is a tightening of the aortic valve in the heart. This valve lets blood go from the heart to the rest of the body, and in aortic stenosis disease, it doesn't open properly and may also leak blood. Leak blood means that when the blood flowing out from the heart is trapped by a poorly working valve, this may cause an increase in pressure inside the heart and cause damage. It commonly occurs when the aortic valve did not form completely.
The heart's main function is to pump blood to the rest of your body. The heart contains 4 valves. Normal valves have 2 or 3 flaps of tissue called leaflets that open and close like gates to control the flow of blood through your heart. Aortic stenosis is a buildup of calcium on the aortic valve leaflets, which causes the leaflets to become stiff over time. This buildup reduces their ability to fully open and close, decreasing blood flow to the rest of your body. Aortic stenosis is usually caused over time as we age, but can also be caused by a birth defect, previous chest radiation, or rheumatic fever. Unlike other forms of heart disease that are caused by genetics, diet, or lifestyle, and can be managed by medications, aortic stenosis is a mechanical problem that cannot be prevented. It can only be effectively fixed by replacing your diseased valve. Aortic stenosis is a progressive disease, which means it gets worse over time. It's typically measured as mild, moderate, or severe aortic stenosis. As a result of the reduced blood flow, the body does not get the oxygen it needs, which may cause symptoms. Patients who have severe aortic stenosis could experience a variety of symptoms that may be confused with simply getting older, including shortness of breath, fatigue or feeling tired all the time, difficulty walking short distances or exercising, lightheadedness, dizziness or fainting, chest pain, swollen ankles and feet, and rapid or irregular heartbeat. Sometimes when an irregular heartbeat or murmur is detected, it could be a sign of an underlying valve problem. Talk to your doctor about diagnosing the cause of your murmur. It's important to know that there may be no outward symptoms of severe aortic stenosis. If you have been diagnosed with severe aortic stenosis and are experiencing symptoms, the disease can be life-threatening and can progress rapidly.
Stenosis progression is associated with the increase of blood flow obstructed through the left ventricular outflow tract and happens for many years. It also says only 10% of patients with aortic stenosis advance to hemodynamically important aortic stenosis. Calcium nodules are located within the layers of the leaflets bulged toward the aorta and can extend to the sinuses of Valsalva, causing restricted motion and obstruction of the left ventricle outflow in systolic activity. Common causes of aortic stenosis is valve calcifications, which is termed calcific aortic valve disease, which was previously considered normal consequence of aging. Talking about applications in medicine, when the opening of the aortic valve becomes narrowed or constricted, which means stenotic, blood is not able to be pumped adequately and the pressure in the left ventricle will increase. Initially, the left ventricle compensates it by thickening its walls, which means myocardial hypertrophy. So like this, it maintains adequate pumping pressure. Later, the left ventricle dilates and its walls become too thin, and the systolic function starts failing.
Treatment for aortic stenosis depends on how far your disease has progressed. If you have mild or moderate aortic stenosis and are experiencing symptoms, your doctor may monitor you and prescribe medications to help relieve any symptoms. Eventually, if your aortic stenosis becomes more severe, the only effective treatment is to replace your diseased valve. There are two effective treatment options for patients who have been diagnosed with severe aortic stenosis: transcatheter aortic valve replacement, TAVR, sometimes called TAVI, or surgical aortic valve replacement, SAVR, or most commonly called open heart surgery. TAVR is a less invasive procedure than open heart surgery. The TAVR procedure uses a catheter, which is most commonly inserted through a small incision in the leg, to implant a new valve within your diseased aortic valve. For patients who have been diagnosed with severe aortic stenosis, TAVR may be an option depending on your risk for open heart surgery. Surgical aortic valve replacement, most commonly called open heart surgery, is another option for treating severe aortic stenosis. Most open heart surgeries are performed through an incision across the full length of the chest, where your diseased aortic valve is removed and a new valve is sewn in. If you've been told you have severe aortic stenosis, only a properly trained, specialized heart team can recommend the best treatment option based on your overall health.
Valve replacement is an effective treatment for adults with severe symptomatic aortic stenosis. This is associated with a minimum risk and discomfort when it's implanted. It does not require anticoagulation and it's durable for patients' lifetime. Patients may include decreased exercise tolerance, also dyspnea on exertion, exertional dizziness, and lightheadedness. Aortic stenosis is more often diagnosed when it's asymptomatic, and sometimes it can be detected in a routine examination of the heart. Heart noises may also notify about this disease by showing a murmur.
I will begin with 3 normal beats and then add the murmur. The severity of aortic regurgitation is directly related to the amount of blood that refluxes back into the left ventricle during diastole. In most patients, the longer this murmur lasts, the more severe the regurgitation.
Talking about pros and cons. Pros, this technique has already been worldwide adopted for inoperable and high-risk patients. The increase of transcatheter aortic valve replacement from an experimental technique repeated procedure, which proliferates rapidly, and also is dependent on numerous keys of advancements, like having better technology for easier procedures and less complications. About cons, it is too expensive. It also has permanent pacemaker implantation, and heart conduction disturbances are the most common complications of transcatheter aortic valve replacement.
At the beginning of your procedure, your doctor will make a small incision in your groin. After creating an opening in a blood vessel, called the femoral artery, your doctor will insert a flexible tube called an introducer sheath. Through the sheath, your doctor will insert a flexible guide wire into your femoral artery. The guide wire will be passed through your femoral artery all the way up to your aorta. Then, the guide wire will be pushed through the opening in your aortic valve and into your left ventricle. Your doctor will use the guide wire to pass a flexible tube, called a catheter, through your aortic valve. A balloon on the tip of the catheter will be inflated to widen the opening in your aortic valve and push the valve leaflets to the sides. After deflating the balloon, your doctor will remove the catheter. The replacement valve consists of a tissue valve surrounded by a wire mesh called a stent. The replacement valve will be compressed and placed on the tip of another catheter. This catheter will be inserted through your aortic valve. When the catheter reaches the opening in your aortic valve, your surgeon will inflate a balloon underneath the replacement valve to expand it and the stent. After placement of the new aortic valve, your surgeon will deflate the balloon. The stent will support and secure the replacement valve in place. The catheter and guide wire will be removed. At the end of your procedure, the introducer sheath in your groin will be removed.
According to aortic stenosis in Ecuador and the research prevalence, it was found that 100 patients with aortic stenosis were reported in the cardiology unit of Teodoro Maldonado Carbo Hospital, which they divided in two groups. First group, patients that had the valve replacements treatment, which were 55 registered. Second group, patients with transcatheter aortic valve implantation, which were registered 45 patients. Also, Clínica de Guayaquil establishes 7% of their patients with aortic stenosis, having a prevalence of 55% in male patients and a prevalence of 35% in female patients. After evaluating the information searched, my conclusion is to start routine evaluations in patients for valuing the symptoms for aortic stenosis and being able to diagnose it. Also, checking assisted cardiac and non-cardiac conditions. After diagnosing the aortic stenosis disease, proceed to look which valve replacement is appropriate, mechanical or bioprosthetic. Also, according this with the patient's preference. After being chosen the procedure, be able to value the durability, the remaining years of life, and the risks, which are important characteristics. Also, make formats and campaigns for providing information of aortic stenosis symptoms for allowing informed shared decisions for patients with aortic stenosis.